Coarctation of the aorta in under 10 minutes. Okay, so let's draw up a heart here. Let's separate the chambers. Let's draw up the aorta. Okay, and in the descending aorta, there is a stricture. And this stricture we call coarctation of aorta. Definition: congenital narrowing of descending aorta. As far as symptoms go, male more common than female. Usually there will be an increase in blood pressure in arms, radial to femoral pulse lag, claudication, murmur that is best auscultated posteriorly. Diagnosis: chest x-ray will show rib notching. On barium imaging, you will see a 3 sign. Angio is your gold standard. Treatment: balloon angio, buzzwords: if you hear rib notching, three sign, radial to femoral pulse lag, think coarctation of aorta. Additionally, there are 3 words in coarctation of aorta. Think of 3 sign. A female with coarctation, consider Turner syndrome. Let's take a look at a couple of vignettes. A 12-year-old boy presents to the office with pain in his legs with activity gradually becoming worse over the past month. He is unable to ride a bicycle with his friends due to the pain in his legs. Exam of the heart reveals an ejection click and accentuation of the second heart sound. Femoral pulses are weak and delayed compared to brachial pulses. Blood pressure obtained in both arms are elevated. Chest x-ray reveals rib notching. Which of the following is the most likely diagnosis? I gotta say, this question gave us absolutely everything that we need to make our diagnosis here of coarctation of the aorta. Taking a look at some of the other answer choices. Abdominal aortic aneurysm presents with a triad of abdominal pain, hypertension, and a pulsatile mass. Pheochromocytoma will present with a severe hypertension that is not responsive to medication. Thoracic outlet syndrome will present with shoulder and neck pain and numbness, usually cold fingertips due to compressed blood vessels or nerves. Let's take a look at one more vignette. 24-year-old male presents for routine physical exam. On PE, you find that the patient's upper extremity blood pressure is higher than the pressure in the lower extremities. Heart exam reveals a late systolic murmur, best heard posteriorly. What is the most likely diagnosis in this patient? Again, they give excellent information in this vignette to help us come up with the diagnosis of coarctation of the aorta. Looking at some of the other answer choices, hypertrophic obstructive cardiomyopathy will be a young patient who either presents with syncope or chest pain when performing exercises or playing sports, maybe even a sudden cardiac death. A patent foraminovaly will present usually asymptomatic, and patent ductus arteriosus as well. Thank you.